And we're live here in Nourish, Heal, and Thrive. I'm really excited for this interview. We have Dr. Khan here. He's a board certified plastic surgeon, and he does some really great work and really excited to hear more about what he does and how he helps people. So, Dr. Khan, thank you for doing this.
It's a pleasure to be on, Derek, to join you and your group and to help share a lot of information. Hopefully, you will find this and our listeners will find this very informative.
Yeah, I think they will. So, we're really appreciative that you're here. Why don't you start by sharing who you are, where you're from, and what you do?
So I am Shaher Khan. I'm a board certified plastic surgeon. A little bit about my training. I majored in biochemistry in my undergrad, and then I continued on to do my general surgery training. Following which I did burns and critical care training. So the surgery was 5 years total. Burns was 2 years, and then plastic surgery was 3 years. So I'm a board certified plastic surgeon, plastic reconstructive surgery. So my aspects of as a surgeon are to help the many patients who have had burns, skin cancer, lacerations, patients with breast cancer, for example. A big part of my practice now is breast implant removal to help patients who have had the silicone toxicity as a result of not only saline implants, but silicone implants as well. And so we are based here in Bloomfield Hills, Michigan, and I'm at the Executive Plastic Surgery. And you can certainly go ahead and learn more. There's a lot of educational information, not only on YouTube, but Facebook, Instagram, and TikTok as well.
Great. And I'm definitely going to ask you, we're going to get more into some of the things you do, but I'm curious, how did you get into being a doctor? Like, what inspired that for you?
So the first exposure that I had was my mom, who's a physician. Following this, I saw the many aspects of medicine, and truly it is a rewarding experience. It is a lot of work, but the whole concept of do no harm, help the many patients in distress, be it the ailments like blood pressure, diabetes, but in a reconstructive sense, to help the many patients. So when I did my general surgery, I saw the many patients who had breast cancer, for example. 1 out of 8 or 9 women will get breast cancer. And so there is so much around us that we see. And I said to myself, I wanted to do something that was very meaningful, that was helpful, rewarding. And I saw that firsthand in my mom. And as a result, that carried through. And I was only very much motivated to continue on to doing the same.
And then how did you decide to get into surgery?
So I knew very much early on in my medical school training that, surgery chooses me. I don't choose it. It's a personality-based process, if you will. If you were to put me as a pediatrician, I would feel very uncomfortable taking care of kids, for example, or cancer patients who are giving them chemotherapy because I find it somewhat where it's a very non-procedural process. I myself, for example, when I saw trauma patients, cancer patients, patients who needed to get their thyroid or gallbladder removed or gunshot wounds to the chest, for example, that was a big part of what was a procedural process in surgery that really excited me. And I really like to work with my hands, as a craftsman, if you will. And so following that exposure, when I did my burns and critical care training, I saw a lot of patients who were burned and they needed reconstruction. It was a very skillful, artistic way of tackling each problem. Even though it was a similar problem in the many patients, it was a different process of dealing with it from a mental, cerebral perspective, planning the surgery. An injury in a 2-year old is very differently managed than someone 20-year old. And you have to be able to not only give back function, but also aesthetics. So that was the other challenging part. So when I did my plastics trading, I already had a lot of exposure in burns. And then I did my research on what is artificial skin, which is Integra. And I invite my listeners, our listeners, to read up on this. Integra is artificial skin where they took cow collagen from the Achilles, if you will, the cow collagen and shark cartilage. And they basically pioneered and made this product, Dr. Yanas and Dr. Burke. And the artificial skin I used in my burns training, and the many patients who benefited from the artificial skin. Now, when I saw those patients benefiting from the application of Integra, this certainly got me exposed to the world of plastics. And the world of plastics is very diverse, from burns to skin cancer to cleft lip palate, craniofacial abnormalities in kids, breast chest reconstruction, oncologic reconstruction, cosmetic surgery. A big part of plastic surgery is hand reconstruction as well, hand injuries. And so there were many aspects that excited me. And as a result, I ended up doing what is a subspecialization in plastic and reconstructive surgery.
Wow. Wow. That's amazing. And you told me earlier that you do a lot with uh, breast implant removal. And
Yes.
I know this is like this has become more important lately. A lot of, people are finding all the toxicities from having the leakage and things like that. And this has become kind of bigger and bigger lately. So, what can you expand on as far
So
as that?
very well said, Derek. As you will see, in 1992, the silicone implants were banned in the United States because they would rupture, they would leak out silicone toxicity. And so a lot of patients who had gotten implants in the 80s ended up getting them removed in the early 90s. And now when the implants were reintroduced into the market and FDA approved ultimately in 2007, we now have the same problem essentially repeating itself, history repeating itself. The breast implants, as highlighted by the FDA and by the manufacturers themselves, they are not lifetime devices. Anywhere from 10 to 15 years is how long they last. There also has been a direct association between implants and what is that very rare lymphoma, which is called the BIA, breast implant associated anaplastic large cell lymphoma, amongst other cancers such as squamous cell cancer as well, and other cancers, for example. And so this certainly was highlighted by the FDA a couple of years ago. And then also another phenomenon that we truly know as breast implant illness, where the patient presents with a constellation of symptoms of what is breast implant illness, from hair loss to dryness of the eyes, migraines, ringing in the ears, throat clearing problems, endocrine autoimmune problems, the rheumatological joint problems, GI issues, cardiac issues. And you have patients with tingling numbness in the arms and legs, amongst the many other 14 organ systems affected. Some in some patients quite a lot, and in some patients not at all. And so we want to go ahead and educate the patients and tell them that go ahead and do your research and understand what is the true informed consent of getting implants, which means that they're not lifetime devices as highlighted by the FDA, and that if you have any of these problems, you certainly need to get attention by a board certified plastic surgeon so you can get these problems addressed. There are many, every year, almost 400,000 ladies or so get breast implants. And eventually, they all need to be monitored and they need to be very carefully basically screened for example, rupture or other problems like fluid around the implant that may be a red flag for lymphoma. And so they need close monitoring. It is not as simple as getting a hip implant and you're done with it and you have it for life. Breast implants are not lifetime devices. The longer patients have them, the higher the chances are that they're going to have complications. And also, I want to highlight, just like you very well mentioned, 1 out of 8 or 9 women are going to get breast cancer. And so it is important for the patients to screen on a monthly basis. The most common way for screening for breast cancer is the self-monthly breast exam. And number two, to get mammograms. So the standard of care is at age 40. The patient should get a mammogram, and depending on the family history, you may want to get it sooner. If there is a family history of breast cancer, one must consider getting the BRCA gene tested, which is the BR breast cancer, CA cancer gene 1 and 2. And this is what I call the Angelina Jolie gene. She had that gene. She did get a prophylactic mastectomy for that reason because she had a 60 to 80% chance for getting breast cancer. So if one has it in the family, they're better off certainly getting a mastectomy, not only on one, but both the sites prophylactically, because there is a 60 to 80% chance for getting breast cancer. And not only breast cancer, but also the ovarian cancer and uterine cancer needs to be evaluated.
Wow. So with all of this said, if let's say, someone watching, they have breast cancer and they decide to get the major mastectomy, do they get implants after that? Or,
So 90% of the patients who end up getting a mastectomy end up getting implants. And so this is where, the patients who end, and remember, 1 out of 8 women, or 1 out of 9 women will get breast cancer in their lifetime. So if you have a stadium full of, let's say, 80,000 patients. 10,000 in their lifetime will get breast cancer. So the standard of care is to go to the breast center, and they will tell you you have essentially three options. Number one is to be essentially flat chested. Option number two, 90% of the reconstruction is to do implant based reconstruction. So be it saline or silicone implants. And then the third one is basically to take autologous or tissue from your own body, like be it a tummy tuck part of the skin that is removed, and that skin is then transferred up onto the breast area so as to reconstruct with the patient's own tissue. And so the advantage of it is you're not taking anything foreign. It's your own tissue. You get a tummy tuck out of it, and you take that. Now, this is relatively speaking a very well established procedure where they do what is a very commonly done deep flap, the deep inferior epigastric perforator flap. But this comes with its own set of problems as well. And not everyone is a candidate for it, but this is something that you should and must discuss. And the point and the take home message here is when it comes to the implants, the patients need to educate themselves, and this is part of the informed consent, as to what are the risks and benefits of any procedure. And in this case, getting implants or getting the deep or the other flap where your own native tissue is used for reconstruction of the chest.
wow. Oh, thank you for sharing that. That's really important information, and I'm glad that you're able to help us here. So, women should definitely check monthly, you said, right?
Yes,
Uh,
self-monthly breast exam. This is when they, and I must mention, believe it or not, there are men as well who are certainly who get breast cancer. I know doctors who have gotten breast cancer, and you would think they would be looking out for any masses. So any mass of the chest, be it a male or a female, must be evaluated so as to rule out breast cancer.
wow. So men should be checking as well. We should be doing
That
our
is
stuff.
correct. That is correct. So men
Wow.
do get it, but at a very decreased rate. Remember, there is glandular tissue in men as well, but it is at a significantly low rate. But this is certainly true, and it does occur absolutely.
Wow. Oh, this is great. And so, what other checks should men do?
So the most important thing here is, the most common cancer in men is prostate cancer.
Mhm.
So you have to screen, you have to go to your doctor to get a PSA screen. And I'm not a urologist per se, but this is as a physician, as a plastic surgeon, as a doctor, you have to get a good regular exam. You are what you eat, eating healthy and smart, being slim, making sure you're not smoking. Believe it or not, in general, alcohol has been shown to be hurtful to the body in every way and regard. So that is very important. Watching out for like sunlight, sun UV damage to the skin certainly adds up. With skin cancer, we see a lot of professions where the men are out in the sun, and there over the years we have seen an increase in melanoma and basal cell and squamous cell cancer. Appropriate screening for colon cancer, which starts at age 45. If there's a family history, then certainly that needs to be done. Colon cancer is the number three killer in the US, but by far prostate cancer needs to be very seriously looked at. We heard about President Biden. We hear about a lot of patients, especially in the African American community, who are predisposed to prostate cancer. So this is very important screening that everyone must do. And so this is again being very uh, 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 proactive in regards to screening, making sure that we talk about diet and exercise. This certainly helps overall with the joint function, as we see the baby boomers getting older. We see a lot of other problems that do arise, and so just making sure that the health and screen exam is done. There are many other lab markers that can be done, like CA-125, CA-19, PSA, which is the prostatic specific antigen that is done to screen for prostate cancer. So there are many other labs that can be done. If one may choose to get a generalized ultrasound of the abdomen. They can be looking out for, any abdominal aortic aneurysm, the pancreatic mass, splenic masses. It's a very quick way to screen for masses of the for the abdomen, and just making sure that you're eating healthy, and diet and exercise certainly goes a long way.
Yeah, and wow, thank you. And with diet and exercise, I do speak to a lot of people that lose a lot of weight very quickly and they have some excess skin. I'm wondering if you have any thoughts about, removing that skin or what.
Right. So this is a big part of plastic surgery, what is body contouring in the world of Ozempic, and patients who are very motivated, who lose weight, or patients who have had bariatric surgery. There is the body contouring where the patients get tummy tuck or chest, upper arm, thigh lifts, if you will. Now, we let the patients plateau to a certain level. And once they have plateaued and the elasticity of the skin has done its job, where the recoil capability of the skin, the younger someone is, the more the skin recoils. Once they have plateaued and they have excess skin, that certainly can be resected. So patients with massive weight loss, they have this excess redundant skin that certainly can be cut out, such that they will look aesthetically more pleasing.
Okay, great. And is that safe? Is it
So it
something?
is generally very safe, and the this is when you have loss of volume, i.e., fatty tissue. You have skin redundancy that does occur, and it can be significant. May affect the patient's ability to walk, exercise. Yeah, so in that case, when you have significant overhang of the skin, be it a pannus, tummy tuck certainly is a very good operation for such patients, so that they can be very practical when it comes to mobility and exercise, and even as simple as ambulation or moving their arms, such that they have their excess skin cut out.
Well, this has been so great, Dr. Khan. Thank you for sharing. Is there anything that we didn't get to talk about that you wanted to share?
No, I think we covered a lot. You want to keep educating yourself. There's so much to talk about. For example, we did not talk about processed meat, for example. Processed food, like hot dogs, or basically anything that's processed meat, is bad. It is certainly indeed very well established. There's no denying the fact. It does ultimately lead to increased rates of colon cancer. And all what I have said, please fact check it, and you will see that this is something that you certainly can avoid. Sugary drinks, for example, like Coke, and all of these high fructose corn syrups, these red dyes. You have to educate yourself and say, again, you do not want to take something that will ultimately only harm. So you want to be very wise and smart. You have the eating, never eat to your fill. Eating one third, for example, solids, one third liquids, and one third you want to kind of keep your stomach empty. So you're always cautious about how and what you are taking in. And it's a very thoughtful process. I find, and this has been shown, obesity is a bigger problem than smoking, and this was one of the studies that came out. So obesity is a major problem. It's like the other pandemic, if you will. So I would caution both the men and the women to be very, very careful when it comes to consuming the right quality and quantity as well. And again, this certainly leads to a better lifestyle, and definitely longevity and better quality of life, if you will.
Wow. Yeah, thank you so much. This was very informative. Uh, you answered so many questions. I'm sure people that are watching and listening, you might have questions for Dr. Khan, and you can put them in the comments here. He's also going to put all his information in the comments. He'll give you links to uh, ways that you can contact him and things that he's doing. And yeah, Dr. Khan, thanks again. Is there anything you want to leave everybody with?
No, just have a curious mind. We all at the fingertips have access to a lot of information. Ultimately, at the end of the day, it's all, and I'll end with this, it's all about motivation and informed consent. As far as we all know, we have to be disciplined and we have to work hard at achieving a certain goal, especially when someone is young. People say, there's a lot the body can take, but as we get older, sometimes we pay a price for what we have done when we were young, be it sunlight, be it obesity, be it smoking, be it alcohol, for example. And so you want to be very careful and invest in your future so that as you get old, as we get old, as I get old, we run into less and less problems.
I love that. And yeah, we should be investing in our future, not just financially, but health-wise, right? Because we deteriorate as we get older, so we need to start now investing in our health.
Right.
Right.
The
That's
ultimate health, the ultimate wealth is a good health.
well said. Perfectly said. So thank you so much, Dr. Khan. We're really grateful that you were here today and shared all this information. Again, if you connected with Dr. Khan and you want to reach out to him, he's going to put comments in the link, or he's going to put links in the comments. And if you like what we're doing here in Nourish, Heal, and Thrive, and you want to be spotlighted and share your gifts and share your information, go ahead and put interview in the comments, and we'll connect with you. Also, if you're struggling and need support, we're here to support you. So thank you, everyone. Thank you again, Dr. Khan, and we'll see everybody at the next one.
Thank you. Thank you, Derek.